Let's start with the generator, and then we can get into tubes and detectors. But there's different size generators, and I think it can be sometimes confusing for a customer to really determine if they're getting value or if they're getting the right system for what their particular needs are. What are the different ranges of generators that are out there?
Okay, well, they start off really small in the mobile imaging market because you have to be able to take the machine and load it into a van, and then you have to drag it into, say, a nursing home, and you have to bring it to the bedside. So they have to be made light, and they can go as low as 2.4 kilowatt. And they serve their purposes well for doing chest x-rays, but they struggle when you get to the larger body parts, like, for instance, a lumbar spine. But, portable x-ray is going to have its limitations. Then when you jump to your regular x-ray systems, they start off at 20 kilowatts generally. And I don't recommend 20 kilowatt generators. Because they're very underpowered for a full x-ray department. The reason people buy them is they're a little less expensive. And if you're a specialty group that's say you're just doing chest x-rays, you can get away with a 20 kilowatt generator. But to me, the minimum that any place should have in the modern day is a 30 kilowatt. And, it's 1.5 times more powerful than 20 kilowatt. And you're going to see a big difference when you get a heavy set patient who needs lower back x-rays. So while there is 20 kilowatts, I don't recommend them unless you have a specialized need. I suggest you go with at least a 30 kilowatt. The difference in the higher ones, when after the 30 kilowatt, they generally jump up to a 40 kilowatt. It gives you even more power, and it gives you a higher MA station. A higher MA station allows you to get a quicker exposure. So yes, a 40 kilowatt is better than a 30 kilowatt, but there is a price difference. People always, got to weigh their budget versus what equipment they're going to buy. After the 40 kilowatt, generators jump up to 50 kilowatt, 65, and even 80 kilowatt. Those require special power requirements. You have to have what they call three-phase power, and most places don't have that. Usually the only places I see three-phase power is in a dedicated radiology clinic or in the hospital market. And you need the three-phase power for the higher generators. 50 kilowatt and above will not run on single phase. So there's also electrical requirements with them. And the reason the hospitals want them is the higher power generators. Of course, you can get through the 300-400 pound patients where you probably won't with the 30 and 40 kilowatt. Plus, they're more robust. They're made to, hospitals go 24/7. They're shooting x-rays, maybe 100 patients a day in some hospitals, and they just want the best generator they can get their hands on. Do you need a 50 kilowatt in a walk-in clinic? No, you don't. But would it be nice to have? Yes, of course. You always want the best. But like I said, budget and needs are going to come into the factor of what you buy.
So sometimes it can be confusing a little bit, but the generator is the power that powers your X-ray, correct? And
Good.
so that's a separate unit. And if you were to go into like the traditional standard urgent care environment, would you say 30 or 42?
I would say the 30. I would say the 30 is sufficient for your standard walk-in clinics. That's what I'd say 80% of them buy. If it's a higher end clinic and they can spend a couple of bucks more, then, I always show them the 40 kilowatt option as well. And I explain to them, it's nice when you have a pediatric patient because you can get like 1/64th of a second exposure with the 40 kilowatt, where you might only be able to get 1/16th of a second with the 30 kilowatt because you have the higher MA station. It's also a little bit more robust as well. But like I said, it's a budget dictates a lot of the times, and most of the time they go with the 30, or there's also a 32 kilowatt depending on the brand. They're either 30 or 32 kilowatt.
And one of
But
the more well-known names is what, CPI? That's one of
yeah,
the
CPI is the generator we sell. It comes out of Canada. It's extremely reliable. It's known to be one of the best generators that there are. And the one we sell the most is the 32 kilowatt and the 40 kilowatt. We do sell the 50 and the 65. And then they also have generators that have fluoro capabilities, which is like if you've ever heard of a barium enema or an upper GI, they need to see motion in the X-ray. So those are specialized generators, and those you'll only generally see in the hospital or dedicated radiology clinics.